You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says that nobody should be wearing a loose-fitting denture. He is Northern California's go-to implant dentist, Dr. Aman Bhullar. Dr. Bhullar, welcome to the program.
Thank you, Randy. Pleasure to be here.
Now, I know you brought a stack of photos, so we're going to try to get to as many of those as possible.
Okay.
But for people that don't know your implant practice, like who's the typical patient you see?
Well, patients usually fall into two categories. Patients that either have dentures that they already have that are loose or they're not fitting very well, that they've had teeth taken out in the past. Sometimes it's been a few years, sometimes it's been decades they've been living without natural teeth. And for those people, we're able to provide them teeth that don't come in and out, that are attached in their mouth, that allow them to eat and chew foods and have a lot more comfort in their life.
In one day?
In one day.
Now, you told me, and correct me if I'm wrong, that for the denture, a person wearing a denture,
Yes.
on the day of the procedure, they could walk in without teeth and walk out that same day with upper and lower teeth that don't come out.
Yeah.
Is that true?
It is. It is true.
Is that rare or that happens a lot?
We do that regularly in our
Okay.
office. It happens very typically. We see it on a week-to-week basis.
Okay, now the second group.
Yeah. The second group are patients that have had challenges with their teeth. They can fall into many different categories, but if they've got bleeding gums, bad breath, teeth that are loose, teeth that have had cavities or decay through the years, these are patients that often, even if have been to the dentist for a long time, they've been going in for their regular maintenance, they've been having crowns, veneers, bridges, root canals that they've had done. And those are the patients that are maybe on the second half of their life, and they've been really invested trying to maintain consistency and going into the dentist. But as you know, over time, everything breaks down. And so those patients are very typical, where they've come in, they've made consistent investments in their mouth, but they're very frustrated and they're looking for a solution. And a lot of times these patients are afraid that they're going to end up in a denture.
Okay.
They've had patchwork dentistry done over the years, and they're looking for something that allows them to be able to smile, eat, and chew with confidence.
So most of these people have heard about dental implants a little bit, and they come in skeptical?
They've heard various things that are out there. They usually have a story to share with a family member, or someone told me about this happened, or this happened with a family member they know. So there's a lot of information available to patients, but we try to help provide them with the real details and what the current condition and what options are available. You'd be surprised by how far implant dentistry has proceeded in the last 5 to 10 years.
Yeah, but people that have like gum disease, gum infection, are their gums too bad to get dental implants?
Randy, those are often the typical patients that we do see that we're able to find help with. Yes.
So no more dentures. That's not an exaggeration, like we said. Do you think that's the future of dentistry? Like whether it's 20 years or 40 years, dentures as we know them won't exist. They'll all be attached to implants?
Yeah, it is already moving that way. The innovations that are happening in the field in dentistry, people should not have to suffer longer with these acrylic, fake, plastic substitutes for teeth in their mouth. Implants are currently they're the best solution that's available for patients.
Now, for the two groups of patients, you've got the denture wearers that you've mentioned,
Yes.
and then people with really bad teeth and gums. If it's been determined all of their teeth have to come out, okay, what are the steps, both for the denture wearer and that other group, to getting their new teeth in your office?
Well, there's 3 simple steps, Randy. 1, to come in, see if they're a candidate, go over how we can make this possible for them. Number 2, that's the fun part. That's a smile design. We customize it to their face. And the step 3 is the day of the procedure. And really the expensive part is step 4, where they're going to be traveling the world, going out for dinner, socializing with people that they've avoided. Oh, Randy, I can tell you countless stories of patients that have changed how they interact with others after this procedure. It really, really makes a big impact on how the trajectory of their life moves forward.
So how old can you be? Like, what's your oldest patient to get this done?
Randy, I took care of a very friendly lady, and she was 92 years old. She came in with a caregiver. We were able to take care of her. And at the end of the treatment, she wanted me to do the bottom as well. Her son wrote me emails and thanked how much youthful and active her mom was again, how she was socializing with her friends, playing cards, we're able to help all ages of these patients.
So age doesn't matter?
Age is not a factor. I've got some colleagues that are I think I've got a friend that's had a patient that they're like 98 years old.
Okay.
And so
when a 70-year-old is at your office and says, "Doc, am I too old?" Not even close?
We get this typically. Patients are often thinking, you know what, I'm 68. I'm not sure if I deserve this or if I should be making this investment in myself. And this is the time to enjoy it, for them to be with their friends, travel, interact with their grandkids. The joy that I see with our patients when they're interacting with their grandkids again. And I had one patient, and they were, "Grandma, why is your tooth black?" or "Why don't you have a tooth there?" As we know, kids are so honest, right? And they'll pick apart, and it really was the motivating factor for a grandma to come in and move forward. And then she brings in pictures and shares stories now. Really has changed her outlook on her life. So, there's so many great solutions for these patients that we're able to solve.
I mean, if implants are so good, and if there's 40 million people wearing dentures, why aren't they all doing it? What's your take?
Well, a lot of times, Randy, these patients that are in dentures, they're not going into the dentist anymore. And in the past, maybe they've been told that they don't have enough bone.
Yeah, but isn't it true if you've been wearing a denture, let's say 10, 15 years, you can't do this because you don't have enough bone?
Well, we hear that often with our patients. A lot of patients that have visited their own dentist or other centers in the past, they've been told that that was the story. But now with the new technology that we have and the advancements of implant choice and design, certain practices, which we've spent a lot of time in training and education on, we're able to help these patients. No bone is usually not an issue now. If patients can walk in to the practice and are healthy, we can often provide them with solutions again where they're able to get teeth on that day of treatment and walk out of here with teeth. Going back to your original question, why isn't everyone doing this? Well, a lot of times, as we've talked about the bone, but it can be sometimes they think that every single tooth needs that implant to be replaced, that they also realize that they may be too old for this procedure. And
so these are all misconceptions.
These are misconceptions, Randy, yes.
But it does seem painful. Is it a painful procedure?
Well, that's a common misperception.
Okay.
Most of our patients come in, they're all numb in the areas, and we've also had them on a sedation, so they're IV sedated, and most times they're sleeping through these procedures.
Okay.
And when the treatment's over, they're surprised that we're done, and then they go home with teeth that are fixed, don't come in and out of their mouth.
And you say they don't even remember the procedure, so it's kind of like an amnesia effect.
Yeah, a lot of the medications that we provide have that benefit there. And we talk to them, we talk to them regularly on the day of their procedure when they go home, and just over-the-counter medications that they're using, just what they use for a normal common headache, and that's all. And they're so often they're so surprised by that it was as comfortable as they were able to have.
So they kind of worried more than they should have.
Yeah, that's often the case. They worry a lot more than they think it's going to be needed. That's
now,
right.
You brought photos, and you said that these people all have regrets.
Yes. The regret was that they wish they'd done this years ago. Every single one of them, and they all wish they had done this sooner.
Okay, let's take a look.
Yeah, sure. Here, I'll share you a photo here. Here's a patient that came into our practice. His name is Bob. Came in. We had to really make him really exaggerate to give us this smile. Coming in, sort of had his head down, and had been into the dentist lots. He'd been missing teeth at the back that had worn down. He wasn't able to chew foods. He wasn't able to bite into an apple or chew steak. He's a retired, successful business owner, and he wanted to really re-engage in life, and was able to find our practice. And one of the options that we had was to have a denture, and that was something that he wasn't interested in. We had determined that his teeth all needed to come out, and then we gave him teeth that don't come in and out, upper and lower set, that are supportive implants in one day.
Okay, is that his after over there? Let's take a look.
Yeah, we'll take a look at the picture here. You can take a look here. And this man now is living life to the fullest. He likes to travel. He likes to eat various foods in different parts of the country, different parts of the world. He's came back from a trip to Asia recently, and he was bragging about the different foods he had, the smiling, shared some pictures. He likes to interact with his grandchildren. He just comes in. Now he's flirting with the ladies at the front desk. He's just having a nice time. And it's a pleasure to have when he comes into the office now. And he brags about how smooth and how comfortable he was through the whole procedure. Randy, now that you've got the two pictures in front of you, don't you think on the right, he looks a little bit more handsome, a little bit younger?
Yeah.
He comes in, he's got a little spring in his step when he interacts with the team at the front desk. It's great to see. It really has increased his confidence in how the rest of his life is going to look.
Now, in his before photo, because those teeth are pretty bad, is that unusual to see teeth like that?
You know what, Randy? It is. You're right. It is unusual because patients that are in this type of situation don't really show their smile or their teeth. They walk around with their head down and just sort of having a bit of a maybe not so friendly demeanor to themselves because they don't want to bring attention to themselves. So you're right, but in my office we see patients like this all the time. You know, they've come in and they've like as I mentioned, he's gone into the dentist. He's taking care of things. He's just frustrated, you know, and he's in his golden years of his life where he's worked super hard, very successful business owner in the Bay Area, and now, you know, he's got his zest for his life again, and he's just, I think he's got a cruise coming up to Europe now, and he's just bragging about all the foods he's going to be eating over there. So it's really, it's
what do they
wonderful to see
like
them.
more, what they could eat or how it looks?
You know, I think it's a combination of both. At first, they don't really realize some of the nutritional value that having teeth that don't allow them to eat certain foods has resulted in their health. And so they'll often report. We've got patients sometimes that are very common, that diabetic patients, very common disease in patients these days, and their doctors are reporting that their levels of their maintenance of their medications are less now, and that because they're eating more nutritious
Correct me
foods.
if I'm wrong. The way dental implants are typically done is you go to one place where they do, one office that does the implants, putting in the implants, and then another office that puts the teeth on top and then maintain elsewhere. You do all three parts. Is that why you do it so quickly?
Yeah, that's one of our real strategic advantages, because you're right, that is usually the typical model. A patient gets referred to another location, and then they have to go back to the first location, or maybe a third location, to be able to do the delivery of the teeth that are fixed, that are staying in the mouth. In our center, we've invested thousands of hours in our training and our education to provide these solutions for these patients in one location.
To do both parts.
Yeah, we've got multiple doctors on our team that provide these solutions, but you're going to be mostly paired with one doctor that's going to see you through the procedure. You know, we live in the area. Patients walk out at the day of the treatment. They have my cell phone. You know, we respond on the weekends to help them out. You know, we own the practice. We're providing that care. You know, it really gives patients a lot of comfort and satisfaction when they know that one doctor is taking care of.
Is it
both
less
aspects.
expensive because you have one doctor, one fee?
Yeah, it allows us to really simplify the process for the patient. And even on our site, we have printing and we have milling that takes place for these patients. What that means is we're able to print these teeth with the technology that we have
Right there in your office, you make the teeth.
just next door. And you know,
Just print them.
yeah, the 3D printing and the technology that is available now for these types of procedures really makes this process seamless for our patients. It's less visits in the office. It's less time in the chair, so less time away from work. And a lot of times these patients within the next day or two are back to their normal routines, back to work, and not having to take laborious time off to recover. Let me show you this next patient that I have here. Okay. So her name is Joanne. Nice lady. She's gone into the dentist very regularly. You may be able to tell in those pictures that those are crowns that she's had done. She's had crowns, she's had bridges, she's had root canals over the last 50, 60 years of her life. And now she's coming in and looking for a solution. She mentioned it to us that when she smiled that she saw a lot of her gums, and she was dealing with some gum infection in a lot of areas of the mouth. So what we did for her is we removed those teeth and we cleaned up all the gum infection on that day. Make sure that we had healthy areas, and we were able to provide her, again, teeth that don't come in and out in that single day. And this is that same lady, you know.
Oh, wow.
Can you believe that?
Looks good.
You know.
What does a person like this, or a typical patient, say when they see themselves for the first time in the mirror?
Man, you know, they're beside themselves. They have to get used to their new smile, actually. You know, she's still learning to get used to her new look, because in the past, she didn't want to bring any attention to herself.
So she didn't smile before?
No.
You think people get the wrong impression of her because of that?
I think we hear that often. Patients will tell us, you know, now we've got a lot of comments from family members, okay? We get calls and emails and text messages. You know what? Thanks for taking care of my mom, because now she's got this new approach to her life. And so, yes, I think patients often are dealing with people that are engaging with them and get a wrong impression that maybe they're not happy, maybe they're stubborn, maybe they're just not very pleasant to deal with. And just not a really friendly feeling, you know? And so now she goes in and she lights up the room. Whenever she comes in for her maintenance appointments and for her cleanings, you know, she's a joy. We love to have her engage with some of our patients that are coming in that aren't sure about these procedures. She loves, let me talk to them, you know, and then really, really helps them feel good about the results that they can get. Yeah. Let me show you another patient.
Okay.
Here. This is Janine.
And these are all patients that could have had a denture, but did not want a denture. Is that correct?
Yeah, this one was great because this was a patient that we saw before COVID. Okay, and then as we know how the world slowed down, and we still kept her. We stepped in communication with her, and then she came back, and then she was, I'm ready to move forward. And one of their solutions, she had no teeth at the back. She had no teeth at the back. She couldn't chew foods. She wasn't able to digest foods. And stuff that we take for granted.
So you say people like even with bad teeth have a tough time eating salads. That seems like an easy one. Yeah. Those things are difficult?
Well, you think of salad, right? Because it's soft and it's just, you think you'd be able to, but they can't bite their teeth together to break down the salad. So they're not even able to get the teeth to touch together to be able to tear the salad apart. So we take these kinds of things for granted. So even vegetarians, you think, well, I don't eat meat and I don't really need those back teeth. And what happens when we don't have back teeth? The front teeth start to flare or they start to wear down significantly.
Is that right?
And we start seeing changes in their bone and in their face. So here's that same lady where we did the type of treatment we talked about her was either a denture or we look at some type of solution. New teeth in one day. Again, we place implants for her on the top and the bottom, multiple implants, and then we're able to provide her teeth that don't come in and out on the single day. This is Jean,
That's good.
And
I'm not trying to side with you, but this is really good. Looks good.
And her daughter came in on the day when we provided her teeth, her long-term teeth, and she was just giving lots of hugs and tears, and they were happening in that room. And now she's got a new lease on life.
She looks like a different person.
She's been told that, yeah. So if you can see her picture, her after picture, we really are deliberate with the smile design. You can see how these teeth follow her lip line. The canines have a nice prominent presence there. And then the color of the teeth there as well. We really customize a smile for these patients.
Do they get to see their teeth, what they're going to look like beforehand? I mean, do you have computer imaging that shows them that?
Yeah, we do have a simulation that they're able to see, but it really doesn't replicate what they're going to get on the day of the delivery. But it does. All of our planning is done, as I mentioned with you, with a blueprint. So we're able to have a real design before we start anything we do in the mouth. We have a clear indication of what the results are going to be. Like when you're driving from here to San Francisco, we know which way we're going to go. There's a path of and our team is able to handle any diversions that may come along the way as well.
She looks years younger, by the way.
Yeah, this is great. She, with the smile design, when we look at this, we talk to our students. We really want to look at really featuring the patients and providing them with something that's very natural. If you can see her pictures before, we don't even see her lower teeth in that smile. Here, we see a nice balanced smile that allows the prominence of those teeth to be visible and also her lower teeth as well. So we really customize it to each patient. That wouldn't work it could work, but for an 85-year-old person, we would maybe handle those situations a little bit differently. But we really listen to the patients and see what they're wanting to have of these results as well. Yeah. All right, this is a great patient that she's been to many places. She's been dealing with lots of gum infection, and she actually works in the healthcare field. So she had been around, she had visited many dentists, and she was really frustrated with the situation she was in. She was dealing with bleeding gums, infection in multiple areas. She had an abscess that was swollen, and she was, was creeping up to her eye. And so we were able to really take care of her at an appropriate time. One of the options was that she was looking at was a denture. Again, she had multiple crowns and bridges that had been done over the years, and she really seeked us out for some of the solutions that
So what did you do?
Yeah, in this case, we removed her teeth and cleaned up the infections, cleaned up the abscess, really, and really improved how she felt overall after we were able to do that. And then on the same day, we're able again to provide her teeth with teeth that don't come in and out.
That you printed in the next room, as you say.
Yeah.
Let me take a look at that photo.
Yeah. She's even got a new haircut now and really has a different approach there. But again, we focus on her smile. And we see her smile, how customized it is to her. If you looked at both of those two ladies, they're proud to wear lipstick now, And if you look at their pictures before, they weren't wanting to wear a bright lipstick that would bring attention to their face. So we see, the smile makes a big impact in these people's lives.
Now we're short on time, and I know you have more photos, so I'm going to rush you a little bit because I want to get through all these.
Let's go through here, Here's another typical patient. This one was interesting. His daughters had booked the appointments for him. A lot of times we see family members, daughters, or we even see parents bringing their kids in, and it really changes the trajectory in our life. He was reclusive, wasn't really enjoying to go out for dinner, and so we were able to take care of him again with the solutions where dentures were an option for him, or we were able to remove the infected teeth here and broken down areas and provide him with implants and with teeth that don't come in out in a day. This is the same gentleman after we were done, and again, his daughters have come in and are so proud of him now, of the initiative that he's taken to come in and address with this. So it's really changed his lease on life now.
And so he could bite into like a steak or like an apple, or you have to stay away from those front teeth?
No, you can bite into steak, apple, corn on the cob, foods that he had avoided. We can see in his previous photo, teeth that had broken down, and he was really worried. He had veneers and crowns that had come off and redone. And now, he had bad breath that he was dealing with.
How soon does that go away? When people have gum infection, they get bad breath?
Yeah, that's one of the symptoms that they have with the bacteria that are present in their mouth, with the infection that harbors in the gums and in the mouths. Patients often don't really think of it too much because it's behind their lips, but these infections can be pretty
So how soon does it go away, the bad breath?
It goes within a way after a couple of weeks. Like as we start removing the source of the infection, which is the bacteria that's there. And I'll carry on. I'll continue.
Sure.
Is it okay if I go through these couple of slides here? This was one of our favorite cases. Okay, this is Jessica. Now we really had to struggle hard to get her to smile for this picture. Okay. And she felt judged because of her teeth. And as I mentioned, her mother had brought her in. We talked about the options. One was going to be a denture. That really wasn't going to be acceptable.
So that's why they go to you, because they don't want a denture.
Yeah.
Is that right? Okay.
That's most of the time people seek us out. We have other doctors that refer to us as well. And because the training in our team is provided and the staff that we have on team. And this is that same lady. You see her after. Okay. And you can tell me when you look at her and how different she looks. And this is actually, she wouldn't leave without a picture with me there as well with her. So, so patients can realize these are patients that we see in our practice.
She looks totally different from the before.
Yeah. Does she look different? Does she look younger?
She does.
She actually told us a story that she went to a social gathering and someone told her, like, you remind me of a friend. Her name is Jessica, but you're not, but you look so much like her. And the friend was blown away that was her because of how different she looked now and how it carries. Just think of like her future job, her interactions, the rest of her life. It's a powerful thing, We talk about smile and men's health.
I mean, look, you're a dentist, so it doesn't surprise me that you probably think the smile is the most important thing. How important is it in your opinion?
Well, researchers from Harvard, or a recent article on Men's Health, said it is one of the top 3 things we remember of a person. Even a small encounter or interaction with patients, when we present with our smile or with our full face, and studies have even showed that it improves our mood and our overall health when we smile. So, it's great to be around. It's great to be around people, and as I said, medical studies are showing that it improves their overall health. Let me finish these couple of the pictures here.
I'll rush it. We're going to
James, okay? This is James. Again, his mother brought him in, and he loves barbecue. He wants to be a chef, and and he's got a young family as well. And now he's interacting with his kids a lot more. This is him after.
Oh my goodness!
Again, these are very typical.
Handsome guy.
We see these weekly. We see this. He's carrying himself. He
would have been wearing a denture, being a young guy like that.
That was his other option at this stage. He came in very confrontational and standoffish. Now he's engaging with
because
the
nobody
staff.
Likes a dentist, right?
Well, we do see that, right? We see patients that come in that aren't sure about it, and the fact that they go through this with very, very comfortably and very predictably, and they're coming in and they're getting his results done, and what we tell them is what they get, okay? And so they're really surprised with the procedure, and our opportunity to help more people is what drives me to bring these types of cases to you.
Time for one more.
Last one, okay? Let me show you this patient here. Came in, she had bleeding gums, loose teeth. We can see the flaring of her teeth. If you look at that picture, you see how the teeth are sort of drifting apart, and their space.
So flaring means they're moving forward.
Yeah, they're spreading away from it. This happens as we have gum disease and we have infection in our gums. Teeth start becoming loose, and we start seeing this movement of the teeth drifting further apart. Okay, it doesn't allow her to bite or chew with confidence, and so We talked about options again. One was a denture, and she's such a young lady. We talked about these types of snap-in type of options for denture, for that secure the dentures better, or the implants that are teeth that don't come in and out. And again, on her day, we just took care of her upper. So we're not always looking to remove these teeth. On the bottom, we were able to do a nice bridge for her, and on the upper, we were able to provide her with, again, teeth that don't come in and out on the same day.
She's got to be happy with that.
She's very pleased. She's one of our favorites that comes in to see
So
this.
you said earlier the trajectory of their life. You say that a lot. So a woman like this, and you can't prove this, but her life in 20 years, 30 years ends up in a different place because of her newfound confidence, charisma, things like that. I don't want to put words in your mouth. Is that what you're talking about?
Well, we see it from our patients' interactions with their team. Okay, some of these patients are widowers. Okay, and now they're out dating again. They're out meeting people. They're out in social environments again. They're applying for jobs that maybe in the past that they would not have applied for. They didn't have the confidence to be in front of an audience or a studio or speak or public speaking. So it brings this type of confidence back to them. Yeah.
Now, you teach this, we mentioned this earlier, to dentists all over the U.S., right? And some out of the U.S. Yes. Does it cost more to go to a guy like you?
Actually, it does not, Randy. We've compared our fees. Our fees are 25% less than the national average. We're able to do this because we're able to do this all on site, and the workflows that we've mastered, and we pass these savings on to our patients. We're able to do these procedures in our office under one roof, and the patients are the benefactors here. Okay,
and we're out of time, but I got to ask you about this. Snap in, snap out dentures on implants. You're not a fan. Could you tell me why?
Well, a lot of the newer practitioners or new doctors, they start with these procedures because they feel like it's easy to get into. It's not as precise, but no one likes them. Patients don't like them, and doctors. There's a lot of maintenance that's involved. There's increased costs. The dentures are still loose and wobbly at the back. It is better than a traditional denture, but it still isn't providing the teeth, like the results that you have with teeth that don't come in and out.
Final message. The two groups, the denture wearer or the person that's been determined all their teeth have to come out. They've heard what you have to say, but they're still skeptical. What do you say to them?
Randy, I invite them into our office. Come in, we'll talk about the options, we'll go over the finances, we'll make this affordable for them. Let's give them the dream smile that they deserve.
Okay, now we should mention Medicare, Medicaid, even the best dental insurance doesn't really cover it, but you say like a good 80% of people finance it.
Yeah.
Is that right?
We're seeing so many patients. We come up with a plan that's appropriate for them, that they can make this a reality. So.
And you have to have okay credit to get finance. What about cosigners?
Cosigners are helpful. There's multiple creative ways we can help them make this. If they want to do this, we'll find ways to make it possible for them.
So if they want to make an appointment, do you prefer they just go to the website, make an appointment there, or just call your office?
Either way, they visit our website. There's more information on there, but give our team a call. Our friendly team will look forward to seeing them.
Dr. Bhullar, thank you for coming on the show. Good stuff.
Thanks, Randy. Thanks for having me.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.